Whether you have become a parent following a pregnancy, surrogacy, or adoption, the transition to parenthood can be a mentally and emotionally challenging time.
There are many unique aspects associated with the postpartum period that can increase the risk for mental health concerns like anxiety or depression.
My name is Dr. Batya Grundland. I'm a family doctor who works in family practice obstetrics at Women's College Hospital.
And I'm Dr. Lori Wasserman. I'm the clinical lead of the Reproductive Life Stages Program at Women's College Hospital. And we're going to share our 3 best tips for protecting your postpartum mental health.
Having a newborn can be overwhelming, often worsened by the associated sleep deprivation. A new addition to the family can feel like it takes up every minute of your day. Highly productive folks suddenly feel that they can't even do the basics because caring for a baby is so all-encompassing. Just finding time to make food and have a bite to eat can be challenging. So how does a parent overcome those overwhelming feelings? Don't be afraid to ask for help and be specific about what help you need. For example, if you can ask someone to drop off food or prepare a meal for you, maybe it would be helpful if another person could hold the baby so you can sleep for a while. Close family or friends might be able to help with household chores or pick up supplies. Take away the stigma of needing a break. Raising a baby is hard work. Remember, it's normal to need help and rely on supports during this phase. If someone asks if you need anything, don't be afraid to say yes.
With so much information on the right and wrong things to do as a new parent, it's easy to feel like you're not doing your best for your baby. The stakes can feel so high with the responsibility of parenthood. It can feel unsettling to not know exactly what you're doing as you adjust to this new role. Maybe you're struggling with how to address feeding difficulties or sleep issues. Strong messages on how to parent from family, other parents, or social media can make it even harder to choose what works for your family. How do you stop those feelings of inadequacy from seeping in? Focus on being a good enough parent. Good enough parenting means being sensitive and empathic towards your baby and responding to your baby's emotional and physical needs. This doesn't mean being a perfect parent. It's not possible to get it right 100% of the time, and that's okay. Remember that what's most important in baby's development is that they are well fed and that they have a loving parent who responds to their cues. As a good enough parent, there's no absolute best way to do things, only what works best for you and your baby. Every baby has their own unique temperament and developmental path. Know that you are doing your best, and your best will be good enough. Practice being compassionate towards yourself. Parenting is hard, even when you're good at it.
Our identity is often shaped by our education, professional work, and our familial and social connections. All of this can easily change when a new baby comes into the picture. It becomes much harder to see friends, be independent, or participate in activities associated with life before having a baby. So how do you manage keeping a sense of self? Make sure to build a realistic and meaningful routine that allows you to keep your identity, even with your new addition to the family. To continue to be emotionally available and meet the needs of your baby, it is essential that we as parents take care of ourselves too. Find simple ways to connect with the people and things that give you a sense of meaning and purpose. Getting together with friends, exercising, or doing simple things that give you pleasure can help you reconnect with your identity as more than just a parent.
If your symptoms progress to the point where you're having poor sleep, excessive feelings of guilt, or thoughts of hurting yourself or your baby, talk to your healthcare professional.
We take postpartum mental health seriously, and we're here to help. For more information and resources, please see the links in the video description below.